Hello everyone, welcome back to my channel Microbiology Easy Notes. If you like this channel, please like, subscribe, comment and share. Today's topic, common cold and rhinovirus. Common cold is a viral infectious disease of the upper respiratory tract which affects primarily the nose. It is also known as nasopharyngitis, rhinopharyngitis, acute coryza and cold. What causes the common cold? It is caused by a large number of viruses rather than by a single agent. Well, there is around 200 viruses which belong to different families can cause common cold. Most commonly implicated virus is a rhinovirus. 30 to 80% cases of common cold are because of rhinovirus. Beside rhinovirus, other viruses responsible for common cold are picornavirus, coronavirus, human parainfluenza virus, human respiratory syncytial virus, adenovirus, enterovirus, and metapneumovirus. Most common cause of cold is rhinovirus, so let's learn about it. It named rhino because it causes congestion and inflammation in the nose. Rhinovirus was discovered by Dr. Winston Price at Johns Hopkins University using sample collected from a sick hospital nurse. First, it was named as Johns Hopkins virus, later renamed as human rhinovirus A1. The virus belongs to the Picornaviridae family. Rhinovirus structure: symmetry, icosahedral, and it consists 12 pentamers. Size is about 30 nanometer in diameter, which is 50 million times smaller than an ant. Envelope absent, but capsid is present. Capsid contains positive sense single-stranded RNA and its size is 7.2 kb. It encodes single large polyprotein later cleaved into structural and non-structural proteins. Structural proteins are VP1, VP2, VP3 and VP4. VP1 location is vertices of the icosahedron. Its function is receptor binding and it contains canyon structure. VP2 located on capsid shell. Its function is structural integrity and it contains neutralizing epitopes. VP3 also located on capsid shell. It provides structural support and also help in RNA encapsulation. VP4 located internally. It lines inner capsid surface. Its function is membrane pore formation during the virus entry in the host cell. Next is canyon structure. It is deep depression surrounding 5-fold symmetry axis. It contains receptor binding sites. Structurally, it shields binding sites from antibody axis, which is a key mechanism for immune evasion. There are non-structural proteins also, like 2A protease, which cleaves polyprotein and shuts down host translation. 2B viroporin, it creates membrane pores and releases calcium ion. 2C ATPase responsible for membrane rearrangement and RNA binding. 3A protease is responsible for membrane localization of replication complex. 3B viral protease is a genome link protein and also a primer for RNA synthesis. 3C protease helps in polyprotein processing, and 3D polymerase is a RNA dependent RNA polymerase. Pathogenesis of rhinovirus. Rhinovirus, with the help of VP1 protein, binds to the receptors present on host cell. These receptors are ICAM1, it is intercellular adhesion molecule 1, LDLR, it is low density lipoprotein receptor, CDHR3, it is cadherin related family member 3. After adhesion of the virus to the host cell, receptor mediated endocytosis occurs. Endosome internalize the virus. Low pH of endosome triggers conformational changes and VP4 released, followed by membrane pore formation and translocation of virus DNA into the cytoplasm. After RNA translation, structural and non-structural proteins are formed. At this point, host immune response becomes active. Nasal inflammation occurs and symptoms also become visible. After the formation of new RNA and proteins, they assemble together and create capsid around them. In the same manner, many virus particles are generated. At the end, via lytic or non-lytic mechanism, new virus particles are released to infect other surrounding cells. Transmission of common cold. The first way is direct contact. Direct contact is the primary mode of transmission. People with common cold usually carry the virus on their hands. If you touch the infected person's hand and subsequently touch your face, the virus can invade your body, leading to a viral infection. The second way is contact with a contaminated surface. Many cold viruses can survive for several hours on surfaces such as countertops, door handles, or phones. If person touches those surfaces and then touches eyes, nose and mouth, become infected with a common cold. Third way is inhaling airborne droplets with viral particles. A person with cold may cough or sneeze, releasing droplets containing viral particles into the air. People nearby can catch those droplets, leading to transmission through the eyes, nose, or mouth. And now, what are the symptoms of common cold? Between day 1 to 3 is a stage 1. In this stage, person experiences throat scratchiness, sneezing, runny nose and nasal congestion, cough and hoarseness of voice. In stage 2, which is between days 4 to 7, symptoms aggravate and are accompanied by a headache, body ache, fatigue, watery eyes, and low-grade fever. In stage 3, which is between days 8 to 10, symptoms starts to resolve, but patient may still have a nagging cough from the respiratory tract infection, which can persist for up to 2 months. But there can be a serious complications of common cold also, which are otitis media. It is the inflammation of the ear, sinusitis, inflammation of the nasal sinus, chronic bronchitis. It is the long-term inflammation of airways of bronchi, and there can be acute flare-up of coughing, wheezing, and shortness of breath. Diagnosis of common cold. Healthcare workers check inflammation of nostril, throat, and lymph nodes. Chest X-rays are done to evaluate if the patient have pneumonia or not. Nasal or throat swab are taken to rule out other illnesses like COVID-19, influenza, and other suspected conditions. Treatment of common cold. Patient can take decongestant, cough syrup, nasal drops, paracetamol or ibuprofen, antibiotics. Antibiotics is given to treat secondary infection caused by bacteria. Usually, it is not recommended. Vaccine. A successful vaccine for the common cold has not yet been developed. But why is it so? Because too many viruses can cause common cold, and it is not possible to create vaccine for each and every virus. And it is also not possible to target around 200 strains of rhinovirus with one vaccine. Another reason is virus can mutate too quickly. So that's why there is no vaccine of common cold. How common cold can be managed? Patients should rest in comfortable surrounding, drink plenty of warm water, use the nasal decongestants or drops, disinfect environment, wash hands frequently, use antihistamine, position the mattress at 45-degree angle, and completely avoid smoking and drinking.